What is the main symptom of adult scoliosis? Scoliosis becomes a compressive condition once skeletal maturity has been reached. Compression is uneven pressure that's being applied to the body because of asymmetrical weight bearing or asymmetrical gravitational push. And when the spine is bent and twisted unnaturally, this exposes the spine to this asymmetrical pressure, and the surrounding muscles and nerves and the entire body is being exposed to these uneven forces. Compression is the main cause of scoliosis pain, and pain is the main symptom associated with adult scoliosis. It's the number one reason what brings on diagnosis and what brings on treatment. Scoliosis pain can involve muscle pain, back pain, pain that radiates to extremities, and it can also lead to nerve compression. Other than pain, we know scoliosis can lead to an asymmetrical body presentation. This uneven forces disrupt the overall body symmetry, so we can also lead significant postural changes. And we know these postural changes is something that continues to occur in the adult form, but it's one of the main symptoms that exposes or brings on the diagnosis of scoliosis in childhood or adolescence. While adults can also experience postural changes, it tends to be more rapid in adolescence and tends to occur more slower in the adult form. In the adult form, once these postural changes start to happen, we can start seeing global changes, like predominant leans to either the left or to the right. They start leaning further and further one side. Or we can start seeing a forward lean, or like where they start going forward. We can see uneven shoulders and uneven hips. There can also be a great amount of disruption to balance, movement, endurance, and coordination, because as the body gets further out of alignment, these movements become more and more difficult. The more severe the scoliosis is, the more noticeable the effects are going to be. Now, when we look at scoliosis, one question I always get asked is, how bad can a scoliosis get? Meaning, how big? And we know scoliosis is a progressive condition, so it's very nature to worsen over time. And we know scoliosis can range widely in severity, from mild to moderate to very severe scoliosis. And we know the number one trigger is growth in adolescence that leads to rapid progression while kids go through growth phases. And unfortunately, the largest curve I've ever seen in a child still growing has been 155 degrees. So these curves can change very quickly and become very severe in adolescence. But what can happen in the adult form, right? Because adults are no longer growing. Can the curve still worsen? Well, we know children are definitely at more risk because they have the chance of this rapid progression because they're normally rapidly going through a growth spurt, and that's what leads to the progression. But adults are no longer going through this rapid growth, but unfortunately progression still occurs. And the progression is slow over time, and it's compressive in nature, just like I mentioned. And this slow compression over time will cause the spine to slowly increase its size. And the progression is very slow in what we call midlife, from 20 to 50 years of age. And it's when you start to break around 50 years of age, we see an increase in the rate of progression. This increase of rate of progression has nothing to do with growth, it's just gravity over time. And once the curve starts to increase the rate of progression, it will continue to increase the rate of progression as you continue to age and as the curve gets bigger. So I always kind of like say, in the adult form, the scoliosis tends to snowball. It's really slow and almost insignificant between your middle life, between 20 and say 50. But as it gains speed, it starts gaining more speed. And this is what tends to lead to more significant progression in older life, meaning 50, 60, 70 years of age. And at this time, if the curve were to gain speed and start progressing quicker again, it can be very difficult to manage untreated. So the two main risk times that we see for patients with scoliosis in adolescence, obviously, but in adult life, it's normally plus 50 years of age, we have a chance of seeing significant progression. And there are different types of scoliosis with different characteristics and different progressive rates. But what I discussed here is the most prevalent type of scoliosis, and that is idiopathic scoliosis, meaning idiopathic scoliosis is normally scoliosis that's happening for an unknown reason. And these are normally adolescent cases that either were diagnosed have scoliosis as an adolescent and they're dealing with the effects throughout their entire life, or they may have been an undiagnosed adolescent, meaning they didn't know they had it because the curve never became big enough to be diagnosed as an adolescent, and they're dealing with the effects in the adult form. Now, interesting, the amount of pain you feel in the adult form isn't really relative to the size of your curve. Like I mentioned, scoliosis becomes progressive once growth stops. And as the spine compresses, it causes pain. And this pain is what tells patients, hey, what's going on? They go take an x-ray and they see scoliosis. So the amount of pain you feel in the adult form is related to how much your spine changes in the adult form. So what I've noticed is that when patients say they stop growing with a 30-degree curve and they go from 30 to 40, they may have a tremendous amount of pain, to where an adolescent could have an 80-degree curve and have no pain, because in the adolescent, remember, it's not compressive. So it's not really related to the size of your curve. It's related to how much your curve worsens in the adult form. Now, the second most common type of scoliosis in the adult patient is something called degenerative scoliosis. And this is normally something that happens to the spine in young adult life, causes the spine to shift, and then that area abnormally degenerates over time, and it degenerates faster than the rest of the spine. And this abnormal area of degeneration will lead the spine to start to develop a scoliosis in that area. Now, degenerative scoliosis normally has the hallmark finding of having an area of excessive degeneration relative to the rest of the spine. Now, a lot of times in adolescent scoliosis left untreated, you're going to get degeneration throughout their spine as well, but it's not going to be an excessive amount localized before it should. Now, degenerative scoliosis is typically diagnosed, again, somewhere around that 50 to 55 years of age. It's more common in females than it is in males. And the rate of progression tends to be associated with the amount of degeneration that occurs. Normally in, again, that later stage life is when we see that progression. So a lot of times if we have a patient that we take an x-ray of at 55 or 60, they have no history of scoliosis, sometimes we're seeing degeneration in both of those cases. It's hard to differentiate whether somebody's a true degenerative scoliosis or an adolescent scoliosis case that wasn't diagnosed and just has degeneration in their spine because they've had scoliosis in their life and their spine for 30, 40, 50 years from when they were an adolescent. So sometimes it can be hard to determine, but we definitely do know as patients get older, the rate of scoliosis, especially degenerative scoliosis, also increase. Now, the question here is, if you have adult scoliosis, can you treat it? A lot of times patients are told that if you have adult scoliosis, there's nothing you can do about it. In fact, a lot of adult patients, if they have scoliosis and they go to providers, the scoliosis isn't even mentioned or addressed as a cause of their problem because a lot of adults can't be treated by the traditional orthopedic approaches when it comes to scoliosis, meaning if the curve is too mild to consider scoliosis surgery, there's nothing for them to do for the adult patient. And then if the patient is too old and have too many health concerns, they can't do scoliosis surgery because the person may not survive the surgery. So what do you do for adult patients? Well, adult patients can be treated with modern conservative approaches. And these scoliosis treatments are normally done to help improve the functionality of the adult patient that has scoliosis by trying to reduce their pain and try to improve their function by reducing the size of their scoliosis, by treating the real cause of all their problems. Most patients that have, adult patients that have scoliosis may have pain, may have back issues, may have stiffness, may have muscle spasm, may have muscle problems, and they normally get treated by providers that treat the symptoms of the curve, but the best thing to do is to try to improve the size of the scoliosis. And depending on the type of scoliosis, whether you have a scoliosis from childhood or degenerative scoliosis, we know there's never treatment guarantees, but the sooner we treat scoliosis and the sooner we work at reducing the size of curve, the more we're going to improve your overall spine, health, and well-being. So if you're an adult with scoliosis, we recommend managing and treating it as soon as possible. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.